those programs one after the other. I am Abdul Aziz Adekunle Adelan, and inshallah to do justice to the topic that we'll be discussing, because we want to have a discussion on stroke, a potentially devastating medical incident. As we all know, that stroke is very common in our society today, so we have decided to bring a professional in that aspect who is going to be discussing with us. We have in house Dr. Ahmed Sulaiman DAZ, a consultant physician nephrologist in Area Specialist Hospital. Assalamu alaikum, sir.
Wa alaikum salam wa rahmatullahi wa barakatuh.
You are highly welcome to today's program.
Thank you for having me.
Alhamdulillah, we appreciate your coming. Sir, we want us to delve into the topic proper. Stroke of a thing. What is even this stroke all about?
A'udhu billahi samil alim mina shaitanir rajim. Bismillahir rahmanir rahim. Nahmuduhu wa nusalli ala rasulil kareem. Rabbi ishrah li sadri wa yassir li amri wa ahlul uqdata min lisani yafqahu qawli. Let me begin by sincerely thanking the organizers of this program for having me today. Now, what is stroke in brief? Stroke can be looked at as a medical emergency. What this means is, if it happens, the sufferer should be in the hospital within few minutes to a few hours for maximum benefit from the treatment that can be offered in medical facilities. However, this is not what we see in our client, because oftentimes when people suffer stroke, they first of all apply tradomedical treatment. Some even apply spiritual treatment before, if these two fail, before they begin to come to the hospital. This is not what should be. Now, we say it's a medical emergency. That means they should, first thing, within the first few minutes, be in the hospital and benefit from the treatment. Now, stroke is potentially debilitating and devastating. Now, we'll throw more light into this as we go on. Now, how does stroke occur? Stroke occurs when there is either a blockage of the vessels that supply the brain or part of the brain, or there's a reduction in the supply of blood to part of the brain, thereby reducing oxygen supply of nutrients to that part of the brain. That is on one hand. Now, if this reduction in blood supply continues, that part of the brain that is denied of blood supply will eventually die. So that is how stroke occurs. Now, there is another type. What we've just discussed is the type called ischemic stroke. There's another type that is called hemorrhagic stroke. That type has bleeding from the blood vessel, because the brain has blood vessels that supply every part of it. So when there is a leak of these blood vessels, it can either leak into the surrounding brain tissue, or it can leak between the brain and the subarachnoid space, what we call subarachnoid hemorrhage. So these are the two ways that stroke commonly can present. Now, the burden of stroke is very high globally. In fact, stroke has been identified as the second leading cause of death and disability worldwide. That is, of all the causes of death, stroke is number 2, takes the number 2 position. Now, in 2019 alone, about 6.6 million people died from stroke globally. So you can see that it is a high burden on us, causing death and disability. Because sometimes stroke may not cause death, but it will disable the sufferer. You won't be able to do those things you used to do again, and you will just be there and you suffer from the consequence of death. Now, in the US, for instance, every 40 seconds, somebody suffers stroke. So that is how common it is. And in every 30 minutes, 14 seconds, somebody dies from stroke. Now, locally, we have our figures. It affects about 1.4 per 1,000 population. So you can see 1.4 persons per 1,000 population is affected by stroke in Nigeria. Those are the figures we have here. Now, we've talked about the types of stroke. One is ischemic. The ischemic type of stroke accounts for about 85% of the type of stroke, while the hemorrhagic stroke accounts for about 15% of the type of stroke that we have. Now, hemorrhagic stroke that accounts for 15% is more severe. That's the one that we talked about, bleeding into the brain, while the ischemic stroke that accounts for about 85% is not as severe as hemorrhagic stroke. Oftentimes, hemorrhagic stroke may lead to death of the sufferer, maybe within 30 days. The sufferer will suffer either permanent disability or outright death. Now, let's quickly look at the risk factors for stroke. Now, this is where we can do something to an extent, because some of these risk factors are either modifiable and non-modifiable risk factors. These are the ways that they are classified. Modifiable means you can do something about these risk factors, as we shall soon see. While the non-modifiable risk factors, there's practically nothing you can do about it.
Sorry, please. I want us to take that straight. The modifiable risk factors separately, while the ones that are not modifiable. But before... You're welcome back to Al-haqq Networks live on ITV, inshallah. We are discussing on stroke this evening, and we still have Dr. Sulaiman DAZ in the studio, who is discussing on the topic. So we're about going into the risk factors of stroke. Please, can we just move ahead?
Yes, thank you. We are going to break the risk factors into modifiable and non-modifiable risk factors. Now, we'll take the modifiable risk factors first. From the name, it implies that you can modify it, something can be done about it. Now, what are these modifiable risk factors? One chief among them is high blood pressure, hypertension. And oftentimes, this is one thing that people don't bother about. People don't check their blood pressure. And blood pressure is one thing that may not give you any sign. You may have a very high blood pressure, but it still gives you time to move around. And when it strikes, it may strike with either stroke or kidney disease or heart failure. So we're using this opportunity to call on our people to always go and check their blood pressure. Either you go to the clinic to check, or you have your blood pressure machine, the digital one. They are so simplified these days. You can just check in the comfort of your home. Now, next risk factor is diabetes. And these two, hypertension and diabetes, they are very common now because of our lifestyle. So diabetes, it has a way it presents, but simply if you go to the hospital, they will check your blood sugar to know if you have blood sugar, especially if you have a family history of these two first conditions we've mentioned. Then you are at risk because they run a genetic predisposition. So you need to be going to check. And again, if you've crossed 40, that is the time that you must take your health very seriously. Then next modifiable risk factor is smoking, cigarette smoking. Now, people smoke for just no reason. If we are to go into cigarette smoking today, that is a topic of its own. So we'll leave that for another day. But it has been found to be a risk factor for stroke and so many other diseases, including lung disease and cancers. Now, obesity is another modifiable risk factor. Obesity simply means when people get too fat than they should be, because there is an acceptable weight for each height. So when you are crossing that boundary of what weight your height should carry, then you are either in the realm of obesity, or you're either in the realm of obesity. So we must cut down on how much weight we gather. Then next is high cholesterol levels. Oftentimes we don't bother to check what our high cholesterol levels are, and we eat unhealthy diets that contain high cholesterol level. So these are some of the modifiable risk factors. Other risk factors are high heart disease, unhealthy lifestyle. We've mentioned diet. we must eat right, eat the right diet, eat the balanced diet, and exercise. This is one area that we do not take seriously, because every now and then, in terms of mobility, you either have a car. If you don't have a car, you have a bike, or you ride on a bike, or you go by cab. So nobody takes walking as a form of treatment. Exercise in itself is a form of treatment. Now, if you observe very closely, some of these ailments we have with us now, we are not there in the times of our forefathers, yes, because they took time to eat right. They took time to exercise. Even those that were attending schools, they walked to schools, they walked to market, they walked to workplaces. So this was, and farms as well. So this was, even if we look at it, oh, it was punishment. In a way, it is very therapeutic. Now on the screen, we can see a man who has suffered stroke, and when we talk about the signs and symptoms, we will see it may affect one part of the body, either the right arm and the right leg, and because of that, the person is not able to walk as it should be. Now, other modifiable risk factors. Now, this man has suffered stroke too, and he has deviation of the mouth to one side. Yes, stroke can affect one angle of the mouth, and it will pull it to one side, and the person can be eating and drooling saliva. What that means is saliva will be dropping from the person's mouth, or when the person eats, the food will be dropping from his mouth. Now, other modifiable risk factors are stress and the use of illicit drugs like cocaine. Now, this can cause stroke in the young, because oftentimes stroke is commoner in old people. Now, we quickly move on to the non-modifiable risk factors. For the non-modifiable risk factors, there is little or nothing you can do about it. Now, first here is increasing age. Now, when you age, some of these chronic diseases are more commoner, or are commoner with aging. So when you age, there's nothing you can do about aging. We all pray to live long, but we must know that some of these things are associated with aging. Now, gender. Men have a higher risk factor in having stroke than women, because women have hormonal protection that protect them from having stroke. Then genetic factors. Some persons have genes that are associated with stroke. Race and ethnicity. Depending on where you come from, you may also be at risk of having stroke. We don't choose where we come from. We just see that this man is from Europe, this one is from Africa, and the other one is from America. So the black man is at higher risk of having stroke. So these are some of the non-modifiable risk factors. For the modifiable ones, as we said, you can do something about them. For the non-modifiable risk factors, there's practically nothing you can do about them.
Alhamdulillah, we thank our Ustaz as he's gradually taking us into the topic of discussion, inshallah. Before we move to continue, we want to throw our lines open for our viewers. In case you have one or two contributions that you want to make, you can easily make your contribution while the program is on. The line is very much open, and the number to call will be displayed on your screen for you to be able to also contribute into the program. Right now, we want to take a short break as well, and when we return, we'll still continue with the program. Please don't go away. You're welcome back to Al-haqq Networks live on ITV, inshallah. We are discussing on stroke this evening, and we have Dr. Sulaiman DAZ in the studio, who is the physician nephrologist that I've been discussing on the topic. Right now, we want to move into the signs and symptoms, how to identify this stroke of a thing. So please, let's move
on. Thank you. Now, how does stroke present? How will you recognize stroke? Now, at this point, it is important to mention that stroke occurs suddenly. The man goes to bed, he tries to get out of bed, maybe to ease himself in the early hours of the morning. Suddenly, he cannot move either a part of the body, either the arm and the leg. He has weakness on that part. The more he tries, the more he's unable to get out of bed. Then he cries out for help. Now, let me quickly state here that what this stroke affected person presents with will depend on the part of the brain that is affected, because the brain serves different functions. The part that serves the hand to move, the leg to move, and all that. So the part that is affected will determine what the person presents with. But commonly, what we have these persons present with, they can have a weakness of the arm and the leg, which we call numbness of one half of the body. They can also have trouble with speaking, or they can talk with slurring of the speech. The speech is no more clear as it used to be. Then you know that this person may have suffered a stroke that affects the part of the brain that is connected to talking. Then, as we saw on the pictures that were displayed on the screen, there could be deviation of the mouth. The mouth can be pulled to one side. You know, if you ask the man to open his teeth, the mouth is pulled to one side. Yes, like we have on the screen now. This is not what a normal human being should be. There should be a balance, or it should be equal. There should not be pulling of the angle of the mouth to one side. So you can have this in stroke. Then some persons may also have difficulty walking, because we've said there could be weakness of the arm and the leg on one side. Some may have loss of balance, dizziness, and severe headaches. Yes, as you can see on the screen, this man also has weakness on...
Please, sorry, let's take this. Hello, good evening.
Hello.
Hello, good evening. Hello, good evening. Hello. I think we're having a network issue. We're going to give another person the chance of calling. Please go on, sir.
Yeah, so these are some of the ways that stroke can present, depending on the part of the brain that is affected. We had a patient in the past who was had a PhD in mathematics, so he was a teacher of mathematics. When he suffered stroke, the part of the brain that was affected was the part that was connected to calculation, so he couldn't solve maths anymore. So you can see that that's how debilitating it could be. Somebody who has a PhD in mathematics, he couldn't solve maths anymore. So depending on the part that is affected.
So I think before we move on, our viewers want to ask questions, and as well we also have questions in here, and we have just very limited time, as I can see right now. So I don't know whether you are already rounding up so that we can move into the question and answer segment.
Well, we can be taking the questions then. If there's no question,
okay. Now, before, we used to see stroke as the sickness of the old. Now, people that are very, very young are already having stroke. We've heard of cases of somebody at 15, 16, 20 having stroke. I think what can be the cause of some of this. Please, let's take this call while we also continue from there. Hello, good evening. Hello. Hello. I think we're still having issues with that network. Please, sir, you can go on.
Yeah. Now, there are causes of stroke in the young, but as we established during the course of the talk, stroke is commoner in the old. Now, things that can cause stroke in the young, we've mentioned some of them, like the use of illicit drugs like cocaine. Sickle cell can also cause stroke in the young, as well as
Hello?
HIV
Sorry,
infection.
I think we have a caller here. Hello?
Good evening.
Hello, good evening, sir.
Good evening.
Please, your name and where you are calling from.
From Benin.
Your name, sir?
From Benin.
Okay, please go ahead with your contribution.
I am feeling some headache and some working of my body.
Okay? I think we've lost that call as well. He said he's feeling some headache and weakness of the body. I think...
yeah, well, it's okay. There are many causes of headache and weakness of the body. We'll advise him to see a doctor so that they will do a proper evaluation to know what is causing the headache and to be dealt with appropriately.
Okay, sir.
Now, it is very important that persons who suffer stroke will present to the hospital very timely, because time is brain. The more time that is wasted, the less the recovery that the person can get when he gets to the hospital. So time is brain. Prompt presentation, prompt treatment can ensure recovery.
Okay, hello. Hello, good evening.
I'm fine.
Please, your name and where you're calling from. I think we are not still getting that. Another person is calling. People are really interested in contributing, but the network is just an issue. Hello? Hello, good evening. Hello?
I think the network is bad.
Yes, it's the network, but I can hear you. We can hear you here loud and clear. Well, sir, I heard during the course of the lecture, you mentioned some of the causes, and you also mentioned about you mentioned specifically said drugs, cocaine, and holders. I want to ask, because of our viewers, does sex enhancement drugs have any issue with, any connection with such as well?
Yes and no. Now, yes, because if the person has, I'm sure you are asking in relation to the man, if the man uses it.
Yes.
Okay. If the man has maybe a heart disease, then he may need to be advised by the doctor if he can use such enhancers. But for a man who may not have a heart disease, then of course moderation is the key, because the activity itself, bedroom activity itself, is quite strenuous. It's not for the lily-livered. Yes. In fact, one of our fathers will say it's comparable to running 3 kilometers of race.
Okay.
So it's quite hectic. So if you now have a compromised heart, that's not the time to use drugs to enhance your performance.
Oh, that as well.
Okay, while we wait for the calls, we may quickly go on to look at what methods we can adopt to prevent stroke from happening.
Okay.
Now, one of them is adopting a healthy diet, eating a balanced diet. Diets that are high in cholesterol, especially diets that are not homemade sometimes.
Hello, good evening. We've lost that as well.
So a healthy diet, then engaging in regular exercise. In terms of exercise, what do we advocate? That means you should either walk out, brisk walk for 30 minutes a day, 3 to 5 times in a week. So
okay.
That will give you the fitness that you need. Then smoke. For those that smoke, you quit smoking entirely, because smoking is unhealthy, it's bad habit, and you waste your money. You gain nothing by it. Then you quit the use of alcohol. Yes, alcohol intake, especially in excess, is another risk factor for stroke. So it's a modifiable risk factor. Then if you have blood pressure, you take your BP medicine to keep it under check, to keep it under control. Then for those that have diabetes, they must keep to their diet, keep to the doctor's instructions, and keep to their drugs, so that the diabetes, the blood sugar will be well controlled. Then periodically you go for checkup.
Al-haqq Networks live on ITV. We are just about rounding up on the topic of discussion, which is a stroke that we are discussing about. We have our Dr. Ahmed Sulaiman DAZ in the studio. He's a physician nephrologist in Ura Specialist Hospital. He's a consultant, inshallah, and he has been discussing on the topic. He started with the meaning of stroke, and he also gave us the types of stroke. Also, he elaborated on the strokes that are things that we can, the risk factors of stroke, before he now decided to tell us the preventive measures of stroke. Sir, I want to ask this question as a form of rounding up, sir, that if, you know, you said it earlier that it is just a sudden incident, what is somebody advised to do immediately? Because there are some things we see online. We've seen online that they say when it happens, get a needle, puncture some fingers, maybe from left to right or from right to left. When you puncture it, the bloods that come out helps in a way of relieving one of that stress before going to the hospital. Is there any kind of first aid one can take that may be helpful?
The incidence of stroke, what happens in stroke happens in the brain. So when you prick the finger that is affected, has nothing to do with the brain. What I will advise is prompt presentation to the hospital, because the type of treatment will be determined by the type of stroke the person suffered. Yeah, so if the presentation is early, there are lots that can be done to either reducing the BP or re-establishing the blood flow, because remember what we said, that is the part of the brain is being denied of blood flow. So you want to quickly re-establish that blood flow so that that part of the brain doesn't completely die. Because the longer you stay away or the blood denied, the more chances of irreversibility.
Alhamdulillah, I think this is how much we can take on this segment of the program. We want to appreciate all our viewers for watching today's program. Our appreciation will be incomplete without appreciating the effort and the time of our doctor, our consultant, who have stood out time to be part of today's program. We appreciate you, sir, and we pray may Allah appreciate you more.
Thank you.
We say Jazakallah khairan for being part of our program, inshallah. Well, we will not completely and continue to appreciate you because we know you are part of us. This call is coming, and I don't think I will be able to attend to the call. It's on that note that we'll be moving to